Thank you, Mr. Chairman. And I think we've heard a lot today about how you can cut all this money and continue to insure people. We now know from the CBO with their truncated score, a score that they should be able to do over the next weeks and months, that millions of people will lose their insurance if we pass this bill. Now, I understand that somebody could have a principled position. Senator Santorum may have had this position in the past, I don't know, a principled position to say the federal government shouldn't be in the business of health care. I've heard people say that for 8 years. And I've heard others, my friend, and he is my friend from Ohio, say that Medicaid needs reform. The problem that we're facing as a country, not just in these states, and I will, Mr. Chairman, may I insert for the record all the money Colorado is losing as a result of this legislation.
We'll
Thank you. And I'd say it's been amazing to watch supporters of this bill waving a flag around, or a map around of who the winners and the losers are. Senator Paul said it very well, that this is a transfer from Democratic states to Republican states. It's obvious what's going on here. And in a world where the Cornhusker kickback, so-called, set off so many people, they should be appalled by that kind of discussion here. But in any case, the problem that we face as a country is that I've got a bunch of people in Colorado who make too much money to be on Medicaid but can't afford private insurance. That is a huge problem in America. And it is a huge problem that there are a bunch of people on Medicaid that if they lose their Medicaid will have an even harder time buying insurance than middle-class people who can't afford it, because we have not created the kind of transparency around health care that other countries have, and we have not created the kind of incentive structure that would drive down costs, which is really what we need to do if we're concerned about preserving the entitlement and doing something useful for our budget. This throws a bunch of people off Medicaid with absolutely no suggestion about how they will be covered, which means that we will once again have uninsured people showing up in emergency rooms all over the country. In Colorado, a lot of, Mr. Chairman, a lot of rural hospitals had 14% bad debt, they called it, uncompensated care before the Affordable Care Act was passed. That number has dropped to 2%. That represents a huge savings that, if those folks are no longer on Medicaid, will be wiped out, and we will be once again chasing our tail around this place. I appreciate my colleagues' commitment to federalism, but I suspect that part of the reason why this has become an attractive vehicle is not just that it's the last one standing, but that it allows my colleagues on the other side, who have voted 60 times in the House to repeal Obamacare, but in 7 years were unable to forge a consensus among themselves about what a theory on improving American health care should be. And so what they've done is left it to the states. An admirable thing to do from a federalism perspective. I'm just suggesting that there might have been other reasons. But in doing it the way they have done it, Mr. Chairman, and Ms. Miller, I'm coming to you, you and I talked about the instability in the individual market as a result of this legislation. Now let's talk about the instability over the next 2 years, as every state in America is going to be forced at exactly the same moment to try to create an entirely new health care system in a 24-month period without knowing what the funding levels are going to be for months and months and months, with part-time legislators, full-time legislators. What does that all look like in America? And who are we, by the way, to set that agenda for our 50 states? It certainly will be a great boon to healthcare consultants in America, but I'm not sure it's going to be great for the American people. Ms. Miller, thank you.
Well, I think one of the problems is I don't know that it'll be a big boon to the healthcare consultants, because states don't have any funding like we did when the ACA passed to hire consultants to help us figure out how to do this.
So is there money, there's not money in this program to set up the program?
To help us figure out what to do? No. And I think that's one of the fundamental issues. But I think it's also that in a 2-year period, I have no idea how we would figure out what this new system is going to look like. Getting legislation passed in Pennsylvania is not an easy thing to do.
Really? It's so easy here. I don't know why it'd be hard there.
And like, we do have a full-time legislature, but we would have to bring all of our stakeholders together, figure out what this new system could look like, put all the pieces in place to make it happen. With the ACA, states had 4 years, and they knew what they were aiming for. They knew that if they wanted to create a state-based exchange, that's what the new system would look like. Here, we don't know what this new system would look like, and 2 years, I'm not sure if we could do it in 5, but in 2 years, I don't know how we would possibly do that. And I think in the meantime, we've got individual markets that are going to be significantly destabilized because this bill will throw the individual market into chaos.
Thank you, Mr. Chairman.